Welcome to Loring Hospital. We're very fortunate to have this facility located in Sac City, serving the residents of Sac County and beyond. I'm Stacy Johnson, the administrator here at Loring Hospital. And what we understand is that these residents want to be served locally for all of their healthcare needs. We want to make sure that we have the facilities and we're ready to serve these residents with all of those healthcare needs as healthcare is ever changing.
Hello, I'm Kara Wellington, Chief Clinical Officer at Loring Hospital. Today we're going to give you a tour of the hospital and clinic and share some of the challenges and opportunities we have to look to the future of healthcare here in Sac County. The hospital board and leadership team are embarking on a master plan to evaluate healthcare services and facilities offered here. Our priorities are to offer quality healthcare service close to home, provide safe and effective patient care while maintaining patient satisfaction, and be able to recruit quality healthcare providers to our hospital and clinic.
Master planning does not mean that we are for sure making any improvements. We are just looking at the resources and the inputs that we put into this hospital to making sure that we don't have to redo something that was done today 5 years from now. We want a strategic plan in place to make sure that we're adopting for all of our healthcare changing needs and for the needs that are needed in this community.
From the time a patient walks through the doors, whether they're a first-time patient or a long-time patient of Loring Hospitals, we want to ensure that we provide a welcoming and caring environment. When people are faced with healthcare concerns, they walk into a setting that's welcoming and inviting. It comforts them and helps to ease the pressure or concerns they may have. While we have made these ongoing updates to make accommodations at Loring Hospital, there are some aspects of the facility that have become new standards in healthcare facilities that we're needing to address. For example, throughout the entire facility, we face challenges with limited storage for medical supplies, limited automatic door access, and inadequate automatic light switches in patient rooms, restrooms, and offices. Let's take a moment to meet several of our staff members who will share their department-specific challenges and identify areas that need to be addressed to enhance our overall patient experience, flow, safety, and privacy.
So when a patient first arrives at the hospital, they normally will go up to our switchboard area and tell our switchboard operator what they're here for, and then she will direct them to one of the two registration desks. The problem with that is between the hours of 7 and 8 and 4 to 5, there's only one staff person here. So that can be a challenge to see when people are coming in the front entrance. If you're with someone already for registration, it's hard to always catch that person. The patients that are waiting to check in, we prefer that they have a seat in the front lobby. Because of privacy issues, we prefer that they not be standing in front of the office doors. They could perhaps hear the patients that's checking in, their birth date, what they're here for, their insurances. So for privacy reasons, we do like to keep no one, kind of standing around in the hallway. Privacy right now is a really big issue that we take quite seriously here at the hospital, and we try to respect everyone's privacy when they check in. But the way that our offices are arranged right now, that does present obstacles every day. The other challenge that we do have is our offices aren't real wheelchair or walker friendly to our elderly population, or perhaps even someone who's had surgery. The doorways are not wide enough to get a wheelchair comfortably through, and then to get it, backed out of the doorway. So if a patient is brought over in a wheelchair and the wheelchair doesn't get positioned correctly in my office, it does become an issue trying to get the patient, when we're done with registration, pulling them back out. So another issue that we have is when a patient comes in either with this type of walker or any type of walker, when they get up to leave my office, to safely get themselves and the walker turned around so they can safely exit my office. So a bariatric wheelchair absolutely will not go through the door.
Another factor we believe needs to be addressed is patient flow and space constraints. One of our considerations is to relocate outpatient services to the front of the hospital to make it easier for patients to get where they need to be to receive their ongoing care and increase the space that needs to accommodate numerous patients at one time.
In our department, our staff has expanded from 1 physical therapist and 2 rehab techs to currently 2 physical therapists, 1 occupational therapist, 2 physical therapy assistants, 2 rehab techs, and a contract speech therapist. Our services include pre- and post-op rehab, sports, geriatrics, musculoskeletal disorders, lymphedema, vestibular rehab, and recently we added Graston technique to our manual therapy. Our department started out as just 1 room, and since then we've expanded to an additional exercise room and an office for the therapist. Although these rooms are in close proximity to each other, it is not very conducive and safe in terms of functionality and convenience, because to move from 1 room to another, patients would have to cross a high traffic hallway, and I find that to be unsafe for these patients. The lack of overall space also raises concerns for patient privacy. It would be ideal to complete a thorough history taking and physical evaluation in a private room to protect the patient's privacy. With sports-related injuries, although we do an excellent job in getting the athletes back to sports, it is ideal to have a larger space for sports program to include speed and agility drills, plyometric, and strength training. Another service that we provide in our department is pre-work screens to various companies to include, but not limited to, VT Industries, Ag Partners, Essentia, and our own Loring work screens. To have a space that is used for just this service would help a great deal with our outpatient workflow. I just want to point out though that even with the limited space that we have, we continue to provide excellent care to our patients. Our department is very busy day in and day out, and we have a steady uptick in patients over the past few years, which is super exciting. That is why we are in great need of additional space in order to effectively serve the needs of all our patients. If our current space was expanded, we would be able to accommodate even more services and provide an even greater emphasis on patient safety, privacy, comfort, and overall satisfaction.
The cardiac rehab and respiratory department is located in the basement, which is not conveniently located for people with heart and lung issues. By the time they get down here to exercise, oftentimes they're already out of breath before they even get here. A few other issues that we have down here is our lack of space. Our procedure room and our storage room double as one. So oftentimes we have supplies on the floor and they're in the way while we're trying to do stuff with patients in the room. Our outlets are on the wall, whereas if they were in the floor, then for the equipment, they could just plug right in and be out of the way. We just really don't have a lot of privacy down here, I feel like. Everything's big and open, which is great, but when we have new patients or things, we just don't have any areas just to have some one-on-one conversations with them. It's also not located by any of our other outpatient or rehab services in the hospital. So if patients need any other services, we're having to take them farther into the hospital to get to the other services that they need.
This is the Loring Hospital Outpatient Clinic, and it was built about 22 years ago, so it was originally for one specialty doctor, and we've outgrown that space. When it was first built, we had no idea that it would be so important to have all these specialists come to Loring Hospital so our patients didn't have to drive to see their specialists. And it's, like I said, it's really, we've outgrown it and we really need more space. We have specialists that all want the same time and we just don't have room for them. And it's just hard to recruit based on the fact that we're running out of space over here. We have one small dictation room back here that actually doubles as our break room. So we have one area for a doctor so he can have some privacy, but we also sometimes eat in there. There's no privacy for the doctors or their staff. Right now they're just standing in the hallway back there, so obviously the patients can hear what they're talking about. We have more nurses and doctors than we have computers. There's very little privacy in the infusion center, so if a doctor needs to see a patient, then we have to take that patient out of the chair, bring them into a room, and have them seen in there, and then bring them back to their chair. And we don't really have a dedicated area for infectious people. Right now they're like put in a separate room, but it's not anything special. This is one of our exam rooms that is used for when the specialty doctors are here, and actually on busy wound clinic days we will wheel in a recliner in here, and it does double duty as a wound clinic and a specialty doctor room because we're short on space. This is the same day surgery area. We do a variety of general surgeries and some orthopedic things and some ENT surgeries. As our amount of surgeries have increased, we run out of room. We have 5 same day surgery rooms over here, 1 operating room and 1 scope room. Those rooms are very, very small. We're stepping around things and we don't have enough rooms. With the new surgeons, we are finding that we're doing 6, 7, 10 procedures a day, and we only have 5 rooms over there. And so sometimes we have to wait for a patient to be dismissed before we can get the next patient in here, which causes a little delay for the surgeon and the rest of the patients. We do not have enough equipment storage. With updated practices, we have more and more equipment, and plus that room is kind of full, and we've also run out of room for like all of our PPE and trying to keep all that separate. So we definitely need bigger equipment storage.
When a patient has an emergency, they want to know someone is ready and available to care for their needs. Navigating to the ER, especially for someone who is unfamiliar with the layout of the hospital, can be difficult. Patients must follow the signs to direct them down a long hallway and around several corners before they reach the nurse's station and check in. This can be especially concerning and stressful when you're facing a medical emergency. The laboratory department at Loring is in a very small and congested space, making it difficult for several employees to work at the same time. The testing we are able to conduct here is limited due to space availability. The cafeteria is located in the basement, making it difficult for patients or visitors to access it conveniently. The space is outdated with windows that are difficult to see out of and little to no private seating options. Loring Hospital has an affiliate relationship with Unity Point Clinic. We strive to provide seamless transition of services from the clinic to the hospital. Many of the clinic providers refer patients to Loring Hospital for outpatient services, surgery, inpatient hospitalizations, which allow us to provide a spectrum of healthcare services close to home. Though attached to the hospital, the clinic's current proximity to the hospital can make it difficult for physicians who need to treat multiple patients in different capacities throughout the hospital, including the emergency room, the inpatient setting, and the clinic setting. This poses major concerns about the current patient flow and accessibility.
Here, we are proud to provide exceptional care to the residents of Sac County and beyond. I would like to point out several factors that could be improved upon in our clinic in order to give our staff, patients, nurses, medical providers the best experience possible. The first one being our front door entrance. You cannot get a large wheelchair through the doors. That's not including our narrow hallways, and you can't even turn the big wheelchair to get in the hallway into a patient room or the restroom back there. The wheelchairs do not go through the door without assistance, and then it takes 2 nurses to get them up to the restroom because the door will not shut with the wheelchair patient. If you have a walker, they're that small, as handicap accessible as we can get them. The countertop when they come in here, there's nowhere for them to set a purse. There's nowhere to, like for registration, it's just their stuff is falling on the floor. They put a window in. There used to be just this roll down window prior. Then they put in the glass window, so they took half the countertop. The congestion at our front area is a big concern to us because we have people checking in leaving, exiting, and we also have a public restroom. The only one we use for the patients is down the basement. So we have 3 things going on right there. The waiting room, the lighting. We have patient concerns and complaints every day when they're trying to fill out paperwork in the waiting room. We have painted it a lighter color. We have taken down the shades. We have put up little lamps to try to make this better. We've changed light bulbs to the brightest we can, and we still get complaints that they cannot see their paperwork. And it is dark. The main entryway is very dark. It's just not very appealing. So it's hard to recruit new nurses, staff, doctors, I feel like, because it's just not real inviting. Back behind where I sit, we have tons of the strips that you plug into because there's no outlets. We have no storage just because we've needed to plug stuff in and move extra workstations in there so we can sit at the desk instead of have drawers. So there's no storage for us. I have big manuals under my desk. I have at least 5 of them right now, and I don't have a drawer for them or a space to put them. We're very congested at our desks, so our phones, it's hard to hear your own conversation because we're that close. The other thing, our nurses are at the far end of the building for us. So every other patient, I'm running to the far end of the building to take a check-in ticket to them. One doctor's patients, we have to go through a hallway that has 3 nurse stations there. You have 3 monitors that are up all the time, and nurses on the phones, and we're taking patients right through that. Another patient privacy concern is the walls seem very thin. You can hear conversations in the next room. Our nurses' stations are very crowded, small, no place to do any kind of paperwork or for them to sort all the correspondence that comes through. They share everything. There's 3 at one area, 2 at one area, and 1 by yourself, but they are very small with very poor lighting. Our provider offices also are very small. They're kind of stacked into their offices as we continue to add monitors and equipment that they need to do their work. They're dark. I don't think any of them have a window, just a small space for them. And this is truly like their second home. So they spend a lot of time here and they deserve a nice office. It is a bit of a challenge for the doctor that is on call if he gets called to the emergency room to get to the hospital in a timely fashion. It's cumbersome to get from the clinic to the hospital ER. Amidst all these challenges that we're facing, we do continue to provide the best care to our patients.
We hope you've enjoyed your tour of Loring Hospital. We sincerely want to thank you for the time that you've taken out of your day to put forth towards our master planning efforts. Our ask of you at this point is to make sure that you guys communicate and share any and all feedback with us. We will then use that feedback to evaluate our processes to go forward and to improve the overall patient experience. We take pride in our healthcare facility and want to make sure that it has all the services and needs that our community deserves.